Hi, I'm Carrie with Motion O.C. Physical Therapy in Irvine, California, here to talk to you about rotator cuff injuries. So the rotator cuff are 4 different muscles that are located around your bone back here called the scapula, okay? And they're very important for shoulder movements. And there's 2 different injuries that usually occur. One's impingement, so that's when the different tendons of each of the muscles gets pinched in the shoulder. And the second one is when there's tendinitis. So that's when you overuse your shoulder, such as overhead activities, and then it causes it to get inflamed and painful. So with these injuries, the common way to figure out if you do have a rotator cuff is if you have this thing called the painful arc. So that's when you bring your shoulders, your arms up like this, and if there's pain here in the middle ranges, that's usually a sign of a rotator cuff injury. So if that is something that you think you might have, here are some exercises that can help you out. So this exercise is called the door stretch. So what you want to do is have both hands up against a door, stand nice and tall, good posture. You're going to act like you're stepping through it, okay, until you feel a stretch. You want to feel a stretch kind of in your chest up here, because it's a stretch for this muscle up here. So when you're holding it, hold it for 30 seconds, do it twice, and that is called the door stretch. So this exercise is called I's, Y's, and T's. So what you're going to do is lay down, like if you're on a bed or something. Okay. You're going to have your arms first out in front making I's. So you're literally making an I with your hands. So all you're going to do is come to about shoulder length with your thumbs up. And you're going to do that 10 times. Okay, and then you're going to make a Y. So literally you make a Y with your hands. So you're going to come out to the side just like this. Once again, do that 10 times. And then you're going to come down here and make a T with your hands. So it's like this, which is why it's called I's, Y's, and T's. And you're going to do that 10 times. You should feel it more in the back, kind of by your scapular region. Okay, and then you want to make sure you're doing this so there's no pain the whole time. And once again, these are called I's, Y's, and T's. So this exercise is called the posterior capsule stretch. It's a stretch for your shoulder to stretch the posterior capsule, which is in the back of the shoulder. So what you're going to do is have your arm come across just like this. You should feel a stretch right about here. So once you feel the stretch, hold it for 30 seconds and then do that twice. So once again, this is called the posterior capsule. So this exercise is called the sleeper stretch. So what you're going to do if you want to stretch the right shoulder, you're going to lay on the right shoulder. Okay, have your arm just like this. You're literally laying right on top of it. You're going to take your left hand and you're going to push down on your right shoulder. Okay, so this is a stretch kind of for the back of the shoulder around here. So what you're going to do is hold it down here, hold 30 seconds, and you're going to do that 2 times. And once again, this is called the sleeper stretch. So this exercise is called the towel stretch. So say you're trying to stretch your right shoulder. So what you're going to do is put it over your left shoulder, grab it with your right hand. So what you're going to do is pull with your left arm so that your right hand comes up along your back. Okay, for this one you want to have good posture, so no slouching forward, have shoulders back, and you're going to try and pull your arm up as far as you can along your back. And the stretch is going to be more like in the front. Okay, so when you get to that point where it won't move anymore, hold it for 30 seconds and do that twice. Once again, this is called the towel stretch. So this exercise is called Isometrics of internal and external rotation on the wall. Okay, and those are 2 motions that your shoulder does. So what you're going to do is stand up against the wall with your arm against it so that your elbow's on your side. What you're going to do is push against the wall just like this, so you're actually moving it like this, okay? You're not just pushing the whole shoulder. So you're going to push against it, hold it for 3 seconds, okay, and then relax. And you're going to do that 10 times, and you're going to do 3 sets of that, okay? So first you're going to push against the wall like this, and then you're going to come against like corner, and you're going to push inward. So same thing, you're going to push against the wall, doing more this motion, not this motion, okay? So push against it, hold 3 seconds, then relax. So you're going to do that for both sides of each arm, and that is called isometrics of internal external rotation on the wall. So for this exercise, it's called scap squeezes. So what you're going to do is have your hands just like this with your elbows on your side, palms up. You're going to go out and in. Out and in. So you should actually feel it for the muscles back here in between your scapulas. Okay, so each one you do, you want to try and feel it there and then come back. You're going to do this 2 to 3 times, or 2 to 3 repetitions for 10 times each. Once again, these are called the scapular squeeze. So for the exercises we just did, just know that it's a generalized program. It doesn't take into consideration your individual differences. So if they're painful at all, we recommend that you stop what you're doing and go seek further evaluation. But for these exercises and this injury in general, we recommend that you stretch, because that's very important for this one. And then once again, just stop if anything becomes painful. If you are interested in getting physical therapy, it is covered by insurances, and we're more than willing to help you out. Our website is inmotionoc.com, and we'll see you soon.